Started. Hello everyone, I'm Dr. Sakshi Agrawal, consultant dermatologist at Satya Hair Solutions, and today I welcome you all on this live session on YouTube. And today we shall be discussing all your questions, all your queries and concerns regarding repair hair transplant. So without wasting any more minute, let me quickly introduce Dr. Shaiil and let me invite him on board to throw some more light on this very relevant topic. Hello, Dr.
Hi.
Shaiil. Hi,
Hello,
sir.
Dr. Sakshi. Hello, how are you?
So, sir, today we shall be discussing a very, very relevant and I think a topic which is very close to your heart. But before that, although I know everybody knows you very well, but let me just introduce you to our viewers. So, can you hear me?
Yeah, I can hear you. Please go ahead.
So, Doctor, yes, I welcome everybody on this live show. You all know Dr. Shaiil very well. He's the co-founder and chief transplant surgeon at Satya Hair Solutions. To date, he has performed more than 100,000 plus successful hair transplant surgeries, and he's still continuing with the good work. Besides that, he's also a very well-known motivational speaker and, of course, a very well-loved artist. And today in this chat, we shall be discussing all about repair hair transplant. So over to you now.
Thank you, thank you, Sakshi, for such a lovely introduction. And Satya Pranam to all my viewers who shower us with so much of love, across the globe. And thank you so much. Yes, repair hair transplant is obviously a topic which is very close to my heart. And these days, Sakshi, we do a lot of repair transplant cases. And hair transplant has really become an industry, and a lot of uh, questions, lot of problems these days people come across. They come to us for repair transplants, but
Yes,
have got already 4 5 transplants,
five
but not even
transplant.
knowing the role of medicines, not knowing anything about the donor management. In fact, most of the times they exhaust all their resources in one shot and then end up having more or less nothing. So
Yes, sir.
we can take the questions now, Sakshi.
Yes, sir. So before starting with other questions, the first question that comes to our mind is that how to identify a bad hair transplant? I mean, is it a perception that a particular patient has, or there are certain criteria by which we can judge the success of a transplant?
Uh, Please come again.
So, how to identify a bad hair transplant? So, a patient might not be satisfied with his transplant, but how
Okay.
would you, as a surgeon, term it a bad hair transplant?
See, actually, today morning only I was seeing one of a person who was driving a car, and he had very thin hair in the front, and I could see that he has got a transplant done. So I was asking the same question to me: is it a bad hair transplant, or is it a bad planning, or is it a bad timing when I'm seeing this patient? So all the three things are important, because it could just be a bad timing. Everything could have been planned in a good way, good manner, and now this patient lost hair, lost the role of medicine in his life, and even the transplanted hair thinned out. So I cannot label this as a bad or failed hair transplant. It was good for that time. But yes, if this patient had um, uh, thin hair, which were made thicker or more to look more dense with just help of medicine, which could be almost 80% of help coming through medicine, then I would label this as a failed planned surgery. So patient can be unhappy with his hairline, with the density, with his donor management, with his overall planning, and most importantly, the planning of medicine. So sometimes when we see some transplants look good for time being, but a very good looking transplant could also be a failed hair transplant in terms of planning, because this guy has put everything at stake in one shot, and that
Yes.
is a very, very big problem.
So, sir, basically, in the same context, if a patient is coming to you who has already got a transplant done previously and he or she is not satisfied with it, then I think you come across two situations. First is where actually the transplant has not been done in the right way or the planning has not been done in the right way. And another situation, which is also very common, is that maybe the expectations and reality of the patient are not compatible. These are the two
Yes.
situations we face commonly.
Yeah, you are right. See, sometimes the line is bad, there are gaps,
Yes.
the angles are incorrect, hair are just standing. So that is wrong execution. And second is wrong planning of medicine. Sometimes people are being told that you take the medicine for 6 months,
Hmm.
then you stop, or 1 year you stop. Then a lot of miniaturized hair grow because of medicine, and then as soon as the patient stops the medicine or the medicine stops working on patient's head, everything is gone, and then it's a big problem for patient. They have very low hairline, their donor is gone, the medicine option is also gone, and they have big, large gaps, to cover, which we cannot cover uh, by any means because more or less everything is gone now.
Yes, so and so when we are talking about bad hair transplant, what do you think contributes to it in the maximum cases? Like we are dealing with repair hair transplant cases at our clinic a lot, and we have been dealing
Yes.
it for a very long time. So I think you are the most appropriate person to answer this question: that what actually leads to bad hair transplant?
In one word, if I would summarize this, it would be unawareness, half
Okay,
knowledge.
half.
Maybe patients are in a hurry, they want to hear or listen a particular set of information,
Hmm, hmm,
and they get to hear those words from everywhere.
hmm,
So,
hmm.
an authentic source, which is difficult to get these days. People who are associated with Satya, they know it very well, and they know this information. Perhaps they don't find out on any of the platform worldwide. So that's the number one thing. So planning of method, planning of medicine, planning of resources. What is the ultimate goal? Whether we are planning it for the long-term benefit of patient, or we are planning it as a short-term gain for clinics
For clinics to
marketing.
do it, yes, sir.
So
Okay.
that is what I think leads to this thing. And a lot of patients these days, they get the transplants done in uh, places where even, I mean, non-doctor run
Yes,
organizations,
yes, yes.
salons, beauty parlors.
So I think, sir, the key factor here should be the surgeon's expertise, because the same surgeon with a less number of grafts can still produce miracle if it is done properly, and even with a large number of grafts, if the surgeon is not having sufficient skills, then or the person who is doing it, sometimes they are not surgeons at all.
Yeah, see, here the problem is not that simple, Sakshi. We daily, very well, so many patients come to us who have got their surgeries done at places which are well
Very good
known, and
centers, yes.
uh, known centers run by uh, okay, decent doctors. But the issue here is again unrealistic expectations. When a patient goes to a clinic looking at the results which were given 80% by medicine,
Yes,
20%
yes.
by the surgeon,
Hmm.
and having the same expectations from his surgeon or
Hmm.
from his donor, then he is bound to land up in trouble, and the transplant and planning is obviously bound to fail. Now, these things patients have to realize. Most of these patients undergo these transplants. When you also see patients, you ask them
Yes.
what are the two main reasons when they generally, which we hear from patients, why did they choose that particular clinic?
Huh. Huh.
Why?
So first of all is like the clinic is ready to do whatever they wish to do. I mean, whatever the patient is wishing, that is the most
Mm,
important thing. And
mm,
secondly,
mm,
most of the patients just follow blindly, maybe some celebrity or some endorsements and all that. And they,
exactly.
in this mad race, they tend to forget that what is most important is to have a natural and a sustainable result.
Yeah, and see, surprisingly, uh, on there is a very important player in this hair transplant industry, and that is a very, very small tablet called finasteride.
Yes.
And this small tablet can do so many miracles, and
Yes.
surprisingly, no one is talking about these things. So that will be a problem. That will be a
Yes.
problem. You
Because
understand?
even in their wildest of imaginations, I don't think they can properly imagine what results finasteride is able to produce. They can't
Yes.
even imagine that.
See, Sakshi, you also know that even we are
We are surprised.
sometimes
Yes.
yeah, it keeps surprising us
Yes.
every
Yes.
single day.
Every
Today
single
also
time.
we had a patient. Uh,
Yes.
so my suggestion to these patients are is like if you want to go for full high dose medicine, go for it before the transplant. Don't
Before
go
the
for
transplant.
transplant. So
Yes.
many patients come to us in this
Yes.
situation.
Because most of such patients won't then go for transplant even for some time until the medicine is working in their case.
Yes, so wrong selection of method, improper planning for medications, having unrealistic expectations, uh, uh, choosing a clinic which does only one particular type of surgery. So, hair loss is progressive. And when you hear a perspective from people that, okay, do it once,
Yes.
so it sets a wrong impression. People think that if they do it once, it will be all right for I mean, forever. Today
Forever. Yes.
morning, I was consulting a patient from New Zealand. The same thing. He had this perception that once it is done, it will be fixed forever. And obviously, that's not true.
Yes. So that's a wrong notion, but basically set amongst everybody's mind that
Yes,
hair transplant is a one-stop solution. You get it done and then you are good to go throughout your life.
yes, it's a journey, and these hair can also thin out.
Yes, yes. So since we are talking about the method that we are selecting during the transplant surgery, so what is your take on we like the most common problem that we face while repairing a bad hair transplant is there is lack of donor available for us during the second surgery or third surgery, whatever we are doing. So what is your take on over harvesting of the donor? And do you really feel that, there are promises being made that 5,000 grafts can be taken down in a single session, and we have seen people claiming, even the patients telling us that it was a 4-5 hour surgery and 5,000 or 6,000 grafts were taken during that time. So we have
You
seen that very commonly. So please
So
throw some
you
light.
know that so many cases come to us where we have seen that even uh, 1,500 or 1,000 grafts are not possible. In
Not
fact,
possible.
today only that New Zealand guy, he had already done one transplant. In his case, it was very difficult to get even 1,000 grafts, and this guy was promised around 5,000, 5,500, 6,000 grafts, and surprisingly, not just from an FUE alone clinic, but from FUT plus FUE
Not
clinic
FUE.
also.
Yes,
And
yes, yes.
this guy was almost ready to believe that, okay, FUE alone cannot give me, I know, but
Hmm.
yes, FUT plus
Yeah,
FUE, since it is being done, this will give me the numbers and I will be
yes.
happy. So many a times people fall prey to this. I would like you to show some um, over harvested donors if you could show in the slide, please.
Yes.
Yeah,
Yes.
move to
Next
the next
slide.
slide.
Next slide.
So now if you see this patient,
Yes.
previous one.
Yeah, yeah.
Hmm.
Keep it here.
So if you see this patient, he has done a transplant. This is pre-picture. All these three are pre-pictures of the patient. He came to me after getting three transplants, and one of them was FUT, and two of them were FUE. And the frontal hairline is shabby, but still, it seems covered. But in the head-down picture, if you see the third image, there are big gaps behind the hairline. He has invested all his donor in this particular portion, and now you look at the middle picture where the donor
Hmm.
is gone. And if you can see the upper portion, the unsafe donor zone has also been harvested,
Yes,
and
yes,
the hair are not there. I mean, I cannot do FUE from here, but still I can manage doing some one FUT. FUT can be done even thrice in some patients where the elasticity allows us to do so. Move on to the next slide, please. Now, this
again,
is,
yeah,
yeah. So again, you can see all these patients. One of the patients is a female patient. If you look at the fourth picture,
fourth
please
picture.
put the arrow there. Yeah, so this picture, yeah, over here you can see the hairline is not good. It's pluggy. It's very, very unnatural, and it is not easy for people to do a female hair transplant. Female hair transplant needs a lot of skill. That's why you see people who are filling grade 6, grade 7 completely from front to back. Even
Yes,
a
yes,
clinic with 1 year of experience, or maybe 1 month or 1 day of experience, is filling grade 7, while we with 20 years of experience cannot fill it without the help of medicine. Now, in females, another challenge is there that finasteride doesn't do that much of
doesn't
help.
that much help.
Now, if these patients, for example, look at the remaining picture, the other picture, this guy, yes,
The
could you
first
move
and
the
second
cursor?
picture, yes, sir.
Second picture, second
Second
picture.
picture.
Move the cursor there. No, no,
The
the
second
pointer.
hairline.
Yes.
Yes.
So if you see this guy, he got a transplant done. In fact, this guy, I remember, still remember, he came to us before the surgery, and he, some or the other way, he was convinced from some other clinic. He got this done. He was put on finasteride after transplant in that clinic, and this ugly-looking hairline also looked decent enough at that point of time. So finasteride, look at the other patient, third picture there. These are irregularly drawn triangles which are at regular intervals. So it all looks shabby. But yes, then you take finasteride, it grows a lot of thinner, softer hair in that area, and it looks pretty good. And
Yes.
even such ugly hairlines start looking good. And once the patient stops taking the medicine or the medicine stops working, it is a big problem, for them.
Yes, sir. So
Next
finasteride
slide. Yeah.
basically covers everything that might go wrong in a transplant. Everything is covered by
Yes.
single medicine. It's
Yes.
it's
What
like
are the
insurance. It's like a permanent insurance, temporary insurance for the surgeon, for the person who is doing it.
exactly? It is more of a cover up. I
Yes,
always ask my patient, it is who needs it more? Do you need it more, or the surgeon needs it more?
this is more right.
And we
Right.
always say RRR. I think you guys have watched this movie RRR. So that is, right time, right dose, and right intent.
Intent.
So finasteride, as Sakshi was telling, finasteride covers up the coverage. It gives you coverage. Anyone who is looking for a transplant wants coverage, so he'll get the
Yes.
coverage. Second thing, you are looking for density. You will get the density also with finasteride, because it will
Right.
grow all. And in fact, the areas where, like, crown or middle portion, which is not even covered, it
Yeah.
grows hair in that portion.
Yes.
Third
Yes.
is hairline aesthetic. We just now discussed how
Mm.
hairline aesthetics can be, improved with this. Fourth is the donor. It is not just the these hair, existing small miniaturized hair. Even donor becomes thick, and the
Yes.
person where even donor has been over harvested, it still
Even that is
looks
covered. Yes.
decent covered. And fifth is the transplanted hair. So in our case, Sheva Akhtar's case, we have seen, and you can share the link also in that portion.
Mm. Yes, sir.
Yes.
So
So
finasteride
next
doesn't
question.
leave behind any marks of a bed transplant surgery.
Yes, yes. So it's a
सारे
cover up.
निशान मिटा देती है.
Yes. And the dosage, the effect is directly proportional to the
Proportional to the
dosage.
dosage. Yes.
So if you give 1 mg per day, knowing very well that even smaller doses, 0.2 mg per day, can work
Hmm.
as far as sustenance of existing hair is
Hmm.
concerned, then
Okay.
the intent is not just sustenance of existing hair, it
Yes.
is something else.
Yeah, much beyond that, much beyond the sustenance of your existing hairs.
Sure.
So, moving to our next question, you have talked in details about how to not over harvest the donor. So, what is the relevance of the technique that is being used in the first transplant surgery, and its proportionality to the success of the transplant? Does it
Okay.
really matter during the first surgery
Yes.
what we are
Yes.
doing?
Yes. See, now if you see this picture which just popped up on the screen,
Please show the.
yeah, So
Yes.
here is again an example of over harvested donor. This is a young guy who has got 2 transplants done. He came to me with this donor, and there were gaps just behind his hairline, and we had to operate him. Now, in this case, if you could just zoom in the picture and see the we took 2 strips from the nape of neck, put the arrow there. We took 2 strips from there, and yes, here, and 200 each, so 400 grafts we could take out. And even if we try to take, further FU is obviously not possible from this area, though we can take out a strip further from there. So those high grade patients who think that FUE can uh, give you a big number. Next slide, please. And switch the mode. Yeah, switch the mode also. I want to see the pictures of donor. If you could just show me the pictures of donor here. Donor management pictures. Donor management picture. Yes.
Yes.
Now, if you see this, here we can see there is a the area which is shaved off, and we have marked it for strip. Now,
Yes.
this strip gave me around 3,000 grafts in this patient, and the area above and below, we did FUE, which gave us somewhere around 1,700 grafts. So, next day we took out the strip, and it was a 2-day procedure. So, again, let me clarify this. This is a very common happening these days, and I am watching like 5,000, 5,500 grafts people claim that they do in one session
Hmm.
of FUT plus FUE, which is obviously not possible. All these patients, the grafts are just dispersed throughout the scalp, and they are put on finasteride blindly, and then result is left to the mercy of finasteride. Now,
Yes.
if next slide, could you just show me the next slide, please? Show the entire the full frame slide. I mean the go back. Yes, go back one more. Yes. So here you can see the strip was taken out, and this strip gave me around 3,000 grafts. And if you see the arrow, that this is like 15 days post-op, a thin line is there, which obviously will heal and scar
Yes.
through scar tissue, all hair grow. Now, we did not go in the second picture. If you see this, we did not utilize the unsafe donor zone. We left a safety margin there, and we could take out around 4,700 grafts from this patient. Had I not done FUT from this marked area, which you can see in the first picture, I would have got 1,000 grafts if I take out 1 out of 3. That
Okay.
means the deficit is 2,000. Now, to get that 2,000, either I over harvest from the zones from where I have done FUE, or I go to unsafe donor zone. And even then, this 2,000 deficit won't be completed.
Hmm.
Then the easiest way out and the commonest way out is telling a lie that we did the numbers and leaving the result to you, the mercy
Mercy
of
of
finasteride.
finesse, right? Yes, sir. Yes, sir. And that is what is commonly happening, and that is why people don't realize the effect of over harvesting on the donor also, because they are taking finasteride and the donor is also pretty much covered while you are on
Yes,
finasteride.
yes. And they don't even realize that they are paying not just through money. So those people who fall for cheap hair transplants, they shall know that they are paying through their health also, because medicine
Yes,
will have their implications.
yes, yes,
And they are paying through paying through the donor also, because donor is something which won't grow back, and doctor
yes.
is not going to put his donor hair in your scalp.
Yes, so
Next
it is
question,
the
please.
most
Yeah,
precious thing. Yes, sir. So
exactly.
up till now, we have discussed all the problems that are there in the repair hair transplant and how to manage it and all that.
Hmm,
Now
hmm,
let's come to the solution. So a patient
hmm.
comes to you for a repair hair transplant surgery. Then what are the challenges that you face while planning his second surgery or third surgery at that time?
Yeah. So the major challenges are, first, the donor is not there, the donor is compromised. Now, if this patient, and most of these patients had earlier undergone FUE surgery,
Actually,
now they
yes,
get back to their previous surgeon. They say, some of them say, okay, we'll take out another 4 5,000 the way they did first time, or so first of all, donor. Then we have to opt for beard, body hair, pubic
yes,
hair, or something like that. and obviously a strip surgery from that
Hmm.
portion obviously helps.
Hmm.
Second is medicine. Many a times these patients are already taking finasteride 1 mg
Yes,
and they have developed kind of tolerance.
tolerance to it.
So what I have seen in such patients, they are, I mean, they can, before coming to us, they consult some other clinics also, where they get attracted either because by seeing celebrities or something like that. So I've seen patients being switched to dutasteride way too soon, and now since the Fricabal and Frica credit won't come
Huh.
with finasteride now, because already patient is at peak of finasteride result and
Yes,
maybe
yes.
a downfall has already started. So in that situation, they are asked to switch to dutasteride, which is obviously not a very smart choice. We don't want to exhaust everything in one shot.
Hmm.
So, see, the world is not falling apart. I think, guys, you should have some patience. Already, you have done one mistake, so please don't repeat it, and
Yes.
be careful when you are doing this. So, and third, the patient is like has lost a good amount of money earlier, and most importantly, faith. So they have lost faith. So sometimes, like this patient, New Zealand patient whom I was consulting today, he got a transplant in 2017, and since then he could not gather courage to get it corrected. Now, after watching our videos, he gained some courage. He got some faith back. Now we are repairing it.
And also, so when it comes to hairline correction, I don't think that we can correct it completely. Sometimes there are a lot of grafts which have been put at a very incorrect angle. It's not possible to take out all those grafts.
Extraction. So
Yes,
some places we do extraction, and extraction obviously comes with a risk. And many a times, such patients have again some unrealistic expectations.
yes, yes,
One patient troubled us a lot when
yes,
we did
yes,
his extraction, in spite of the warnings, so
yes.
many warnings which we
So I
gave
think
him.
I
But
think the
yeah,
counseling is even more important in cases of repair hair transplant, because
exactly.
when they are going for a second surgery, since they are paying the amount second time, they are undergoing the procedure second time, so they have even more expectations from a repair surgery than the
Another
first
issue,
time.
another issue here is that they most of their multigrafts have been cherry picked. So
Yes,
now these patients are left
these
with these
leftovers.
scars.
Yeah,
Can I see that video? Yeah, please show me the video.
the donor video.
So donor video, FUE already extracted in the first surgery. Now there are gaps and scarring in between. Now, if we try to extract grafts from these area, there is a big problem, and these patients, I mean, trying to harvest those hair, because the angles change, we might end up cutting the hair, not getting it, and whatever hair we are getting now, the uh, hair per graft ratio is not favorable. Most of the
Yes,
grafts are single unit grafts. So, and in these patients, if at all, some benefit could have come through medication had already been used. So
okay.
second time surgeries mostly fail this way.
Yes, sir. So it is equally important to gauge the expectations of the patients before going for the second surgery. They need to understand that what is the maximum benefit they can get with the surgery, and then they should go ahead with it.
In fact, this is very much true. Now you can see the video here. It is very much true for first surgeries as
First
well,
surgery as well.
because
Yes.
sometimes the patient thinks that okay, he'll have a very low hairline. Now, guys, you can see here, FUE had been done, so it healed with scars. Now the angle of hair changed. The angle which we are targeting now in second FUE has changed under the skin. So when we try to remove this hair, I mean, when we try to remove this hair, the problem here is that this will be an issue, and this will get cut. Understood? So
Yes.
yeah, come back. So now, what we were discussing, what were we
So
discussing?
we were discussing about there is a lot of gap in the reality and expectation, particularly for patients who are going for transplant surgery, whether it's first surgery or it is the repair surgery.
Yeah. So many times, getting the hairline low, patient wants that
Hmm.
he wants this hairline very low. He
Hmm.
wants to cover up the entire thing. So uh, those who are listening, you can close your eyes and just listen to this. Oh, you will be needing this surgery only once. Ek baar kar denge and then it is done forever. Second, okay, you won't need any medicine, or if we are giving you medicine, we'll just give it to you for maybe 6 months or 1 year. Oh, we will cover the entire thing from front to back. Oh, only FUE will cover the entire thing, and no stage, nothing. Do it once and do it right, and forever it is gone. And but so uh, uh, isn't this what you want to listen, want to hear, or
Yeah.
this is what people will tell you? But if a person knows the limitations, uh, hair transplant doesn't really set you free always. It
Yes.
also has its limitations, and if you don't respect or know those limitations before starting the journey, you might end up in big troubles, and you will be robbed of everything.
Yes, sir. And I think so. This understanding is more important during a repair surgery because, as a wise man once said, that fool me once, shame on you. Fool me twice, then shame on me. So the knowledge becomes more relevant when you are undergoing a repair transplant surgery.
But sometimes, unfortunately, the marketing is so intense, and I have seen people getting their repair transplants done from particular clinics, and now these guys are marketing like anything and telling the patients that we are your well-wishers. And
Yes,
now, what experience this guy has? Uh, what is his qualification? Nothing.
nothing. Yeah.
Nothing. And the guy is just acting as a commission agent for a clinic, and you know, creating a funnel where patients are being pumped to the clinic, and that's it. I mean, these patients will repent and for rest of their lives. So
Yes.
please be careful.
So, sir, according to you, what should be the ideal time? Like once a patient has undergone a surgery, and if he or she feels that the results are not appropriate, then what should be the ideal time to wait and then go for a repair surgery? How much should one wait?
Well, it depends. At least give 7, 8 months, 9 months, or maybe if you can wait for an year or so
Hmm.
before you take a call. And yeah, that should be the ideal time.
But they should at least take a consultation when the earliest signs of a bed transplant are visible. They should at least take a consultation, right?
Sakshi, now so many patients they come to us.
Yes.
We had patients where uh, uh, one patient told me this guy was a doctor himself. He had done one transplant earlier somewhere else, and then he was lying on the table, OT table of one of the clinics where he was paying uh, a huge amount,
Hmm.
and the clinic is marketing very well. He was lying on the OT table, and he was waiting for the doctor to come. And in the meanwhile, he was watching. Somehow he came across Satya's video, and he watched the video. You
Yes.
remember?
Yes.
And
Yes. He
this
left.
this patient, he left.
Huh.
So the doctor was there, and I think they had done some 100 odd extraction also, but he he left those hair also, and he just ran away from there.
Yes.
So that was one of the funny things which happened. But yes, so and so many patients they get their transplants done, but they don't even have any idea about the medication. And after the day of transplant, a printed prescription is handed over to them, which says you take 1 mg finasteride, and the duration is written, okay, 1 year, and we will see after 1 year, maybe we will
Hmm.
stop, slow down,
Yes. Yes.
reduce the dose, taper, and all that stuff. Now this guy is in real trouble. Now he doesn't know, and somehow
Hmm.
he sees the video of Satya now after getting the transplant done. So those who watch our video after getting the transplant done, they obviously come to know the reality, and they expect the same amount of
Yes. Yes.
transparency and honesty and skillful approach from their respective surgeons, which perhaps they sometimes find deficient.
Yes. Yes.
Deficient. So then they call us up and do so many things. Then So
Yes, sir.
yeah,
And this is actually it's very relevant. I have also observed that जो patients हमारी videos बहुत अच्छे से देखते हैं and who try to understand the basic concept of hair transplant, it is so much easier to explain to them, and somehow their expectations always match with the reality. Maybe because we are
exactly.
aware of all those things, so it is very easy to match their expectations with the reality.
See, when you know the pitfalls, when you know the limitations, you can obviously plan beforehand.
Yes. And also, sir, like you have also seen abhi 2 दिन पहले we have a patient in follow up who has got a one transplant done from us, and he has already planned his own surgery, a repeat surgery, because he has carefully planned his whole journey, and he's as aware as we are, I think, about the subject.
Now, the funny part here is, see, when an FUE only surgeon says that, okay, we will fill the front portion first and then we will fill the crown and all that stuff. Now, this sounds very funny to me because
Yes, yes,
already they have taken a big chunk of grafts from there. Now,
yeah.
just we showed this video where the graft angles get affected and so many issues. So,
Hmm.
it is not good. Now if
Not,
this guy
not
says okay, we'll cover this in second step, I cannot digest this.
So I think the most important thing for a patient to choose while going for a first transplant is कि that clinic should be performing all the available techniques of surgical and
Exactly.
non-surgical restoration. Then he is safely, मतलब he can assume that he is in a safe hand.
Then only he can just assume, but
Assume,
he
yes,
may or may not be in safe
may
hands.
not be. Yes, sir.
So
Yes,
number
sir.
one criteria is if you are going to a clinic which does only one type of surgery, do you expect them to give you the, if you have very curly hair, even then they can tell you, okay, we'll do FUE because there is no other way they know. So that is one of the easiest way of ruling out clinics, but it doesn't give a character certificate to those who are doing FUT plus
FUT,
FUE.
yes.
One has to see the record. Many a times, shaved off head pictures
Hmm.
are being shown, and this looks really. I mean, and I mean, just look carefully the results which are being shown to you. No transplants done here, but everything gets filled. One
Yes,
thing which you can, I mean, a small tip for all the patients who are watching this, they can look at the situation of donor and non-transplanted zones in post-transplant pictures. So if they see a significant improvement in those areas, then then keep in your mind that this proportion would be even heavier in the areas where they did transplant if
yes,
it had some hair in that portion.
yes.
So that way they can maybe get a little bit of idea
Yes.
to what extent they are over judging the results.
Yes, yes, and also they should ask for the images of the patients where the graph distribution is clearly visible, so that they can
Yes.
gauge the result, whether the result is because of the graph placement or is it because of the medicine. So this was
Uh,
all about the repair hair transplant. Now we get a lot of patients who have undergone a beard transplant, and it has
hmm.
gone terribly wrong. And it is particularly hurtful to see because most of these patients are very young, sometimes 24, 25-year-old boys, and it's very disheartening to see them with a lot of
Could you
cobblestone.
show some pictures there?
Yes, we
You
have.
have?
So please show those in the slides.
Yeah, so see, these people are young. They have maybe some budget constraints also. They
Yes,
go
yes,
for something which is right there on their face, wrong angles, cobblestoning.
yes,
This is something which is really difficult to clear. And again, I'm telling you, clinics which are flashing results of grade 6, grade 7 by FUE, covering cricketers,
yes,
covering actors, singers, you won't see that many beard transplant cases from their side because uh, here finasteride is not going to
not going to help
cover
them.
it
Yes,
up.
sir. Yes, so
So finasteride is I call it finished ride, or we call it finish it right.
finish it
So it
right.
is not just do it right, it is like finish it right with the help
Yes,
of finasteride.
yes,
So
yes,
guys, be careful. In such cases, we can try lasers, we can remove these, we can extract some of them, but it is really difficult. It will lead to scarring. So don't get something done which cannot be repaired, and don't be in a hurry. Don't just believe anyone.
Yes. So, sir, quickly then, before wrapping up this topic and we'll take the viewers' questions. But before that, what should be the checklist that one should maintain before planning for a hair transplant? A quick checklist कि ये points तो tick होने चाहिए. Then only you should go ahead with the transplant at a particular center.
Yeah,
Please show the slide also.
yeah, show the slide. And after this, please show the slide of some repair cases as well. I mean, the results which we did, female as well as male. I would like you to show some results. So, yeah, so the checklist is, so, see, when you plan your surgery, you go to any clinic, you have a particular, you have a grade of baldness. You look for similar cases.
Yes.
The what kind of results this clinic is giving or this doctor is giving to those patients, and you get inspired or discouraged after seeing the results, whatever. So your judgment is based on totally and solely on based on the results which they are showing. Now, do you know whether this patient was put on finasteride or not? So, number one question, the results which were being shown to you, if they are 1 mg finasteride, then if they were put on finasteride, when was finasteride started? And at what dose? Again, the right time and the right dose, and with what intent. So if the intent was to get free ka credit, then obviously it will be not that good. But if the intent was really to sustain the existing
Sustain the
hair, which
existing
were
hair.
thinning at a rapid pace, then maybe yes.
Hmm.
So if most of the patients which you are seeing now, here a word of caution that they may tell you that we did not
Yes.
start finasteride. Now, a very funny thing which is happening these days, and you also see those patients,
Yes.
where in fact many of the influencers, they when they develop tolerance to the medicine finasteride,
Hmm.
now initially they, after getting their repair and everything, they were telling patients that we are taking भाई finasteride लेते हैं भाई finasteride से ये तो सही
Hmm.
रहता है, तो एक ब्लड प्रेशर की गोली की तरह होता है भाई ले लो. So initially these were the words which they were telling. Now once the tolerance has set in and they are losing hair, so now they are saying, since we were not taking finasteride, so these hair have fallen. So you understand?
Yes.
So
Yes.
they may tell you lie if you want to hear from their mouth that, okay, without medicine we will do. But how can you believe someone who is showing you results of finasteride? Entire
Hmm.
life they have showed the results of finasteride. Now, just because you are asking that I don't want to take the medicine, they get back the slide, please, the previous slide. Now, just because they say they are saying in front of you, but be
Hmm.
aware, okay?
Yes.
Donor area after surgery, obviously important, but this can also be manipulated through finasteride.
True.
So be
Yes.
careful. Many of the people are under this presumption that they think that donor hair grow back when
Yes.
they are
Yes.
extracted, and it
Yes.
is being shown in that way only.
Yes.
They will never show you cases where donor is completely gone or devastated. They will just show you uh, cases where donor is still decent. Okay, so
Yes.
be careful. So plans of surgeon in case baldness progresses further, it is again very important, because if the surgeon doesn't plan for it, suppose if you are doing one FUE, now second time if you plan the surgery, it has to be FUT. But if your
Yes.
surgeon doesn't have the skill,
Yes.
doesn't know how to do it, or maybe just to tell you, okay, we'll do later on,
Hmm.
then maybe, but don't trust it blindly. So is your surgeon well versed in all available? This we have discussed. So
Yes.
many a times synthetic hair, scalp micropigmentation,
It all
even
comes
hair
to
weaving,
rescue.
yes,
Yes.
they can come handy and they can
Hmm.
rescue you from situations, from impossible situations. So if your surgeon is well versed with that, it would be a great help. And in fact, knowing all this beforehand, and knowing that your surgeon knows this, both of you as a team can plan your journey. As I
In a
always say,
much
hair
better way.
restoration is a
Yes.
journey. Yes.
Yes, sir.
Spinal hairline as promised by your surgeon, will it be possible to sustain in long run? Yes. So again, So many a times people tell us, "Oh, sir, you are making a hairline which is very up. Why are
Yes.
you doing this?
Yes.
This is useless. This doctor, doesn't
हाँ.
know how to make hairline. This should, I mean, Dr. Shail should go to some XYZ clinic and learn how to make hairline." Okay, and there was one one patient, grade 7 surgery. So, what would be the best strategy? Someone asked in YouTube question, what would be the best strategy
हाँ.
to for grade 7? So the guy, the gentleman, the Param Andhbhakt commented that go to that clinic. Best
Mhm.
strategy is that,
हाँ.
and eat finasteride.
Yes.
So
So
so final
people
hairline.
actually
Yeah.
so compare the level of the clinic by the level of hairline that they are putting. They don't see how
Yes,
natural it is looking, how sustainable it is. They're just seeing
and
the
how
level.
much and how much help is coming through
Yes.
finasteride. If you are
Yes.
getting a lot of softer hair, now look at my hairline. This is 2 years old now, and
Yes.
no minoxidil, no finasteride. So here the skill is from surgeon, density, merging, the softer look of hairline. Everything has to come through the art of surgeon, not free ka bal, free ka credit, free ka art, free ka sab kuch.
Yes, sir.
और बाद में डोनर कितना बचेगा, so that is again very important. Suppose
Hmm.
if you are you are investing all your donor, आपके 7,000 बाल यहाँ लग सकते हैं, 7,000 निकल भी सकते हैं मिला मिलू के. It doesn't mean कि मैं 7,000 लगा दूं आपके,
Hmm.
because even the transplanted hair can thin out over a period of time, and then you will be in big trouble. So any surgeon who prioritizes your life and your goals in front of, I mean, ahead of his personal benefits, which he may get through references or maybe through advertising the results,
Hmm.
I think choice is yours.
तो सर हमें थोड़ा-सा इसका मतलब डोनर एरिया कुछ तो हमें फिक्स्ड डिपॉज़िट की तरह रखना चाहिए, पर्टिकुलरली अगर एज कम
Exactly,
है या डिज़ीज़ अभी भी प्रोग्रेसिव है
exactly,
तो।
exactly. So important, so important.
ओके सर। सर कमिंग टू द नेक्स्ट क्वेश्चन जो आई थिंक आपने बहुत ही बार सुना होगा, पेशेंट्स जो भी हमारे पास आते हैं, दे कम विद द होप दैट सिंस वी आर डूइंग ऑल द पॉसिबल टेक्निक्स, तो वो हमसे रिक्वेस्ट करते हैं कि सर आप एक ही बारी में अच्छे से कर दो, ताकि हमें दोबारा नहीं करना पड़े। So that is also again a misconception very common among people that they are coming to you thinking कि आप एक बार में कर देंगे फिर दोबारा कभी कुछ करना नहीं पड़ेगा उन्हें।
ये जो डू इट वंस वाले नैरेटिव्स है ना, दे क्रिएट this thing, this expectation in mind of patients. So it is not do it once.
हाँ,
It is a journey. Your
yes,
life is not an Instagram picture. You have to plan it right rather than doing it right. पहले plan तो कर लो, बाद में ढंग से कर लेना उसको. So planning is so important. If you don't plan it, you have because what will happen? अभी हमने भर दिया. Now these hair transplanted hair, they get thinner. Now we merge this from with this, but now this is falling. You end up having a island hair and a body hair. अब आप क्या करोगे? Now you are gone and there is no donor. अब ये अब आप मतलब what will you do? Nothing.
Hmm.
और आपके do it once right वाले तो गए. So then you are not left with many options. So
Yes,
please, when you have options, you feel more powerful. You have freedom. You have choices.
yes.
So understood.
यस सर। सो आई थिंक सर हमारे आज के चैट जो लोग देख रहे होंगे, आई थिंक ये चीज़ उन्हें
उनके
क्लियर हो
क्वेश्चंस
जाएगी।
ले लेते हैं.
यस सर, उनके
हाँ,
क्वेश्चंस ले लेते हैं। देयर इज़ अ लॉट ऑफ डिफरेंस बिटवीन अ केयरफुली प्लान्ड सर्जरी, सक्सेसिव ट्रांसप्लांट सर्जरी एंड अ रिपेयर हेयर ट्रांसप्लांट। देयर इज़ अ लॉट ऑफ डिफरेंस बिटवीन दीज़ टू।
exactly, exactly. So apparently, with the surgery, which is looking very great right now,
यस,
might have robbed you of all your resources, all your donor, and all your medical options, सब कुछ, and maybe your health, and you might
हुँ,
not be knowing. And such patients, give testimonials sitting on sofas of the clinics, and after 6 months, they come to us for repairs.
यस सर। सर अभी
Yeah.
यस
So we
सर,
have some questions already,
यस,
huh?
यस, यस सर। सो देयर इज़ मिस्टर अनिरुद्ध बना। He wants to ask about beard transplant. His
My
age
age
is
is 20. I
29.
have
Yes,
problem
sir.
that my beard is coming. Anirudh, hello. Anirudh, I have answered you in the questions also, beta. Don't worry. It will get equal with age, and 20 years is a very short, small age. Wait till age of 25 years, and then see. I mean, by that age, we expect it to improve. Next question, please.
सर
You
एक
show
हमारे
only hair
पेशेंट
transplant
पूछता है.
results
हाँ.
show, but not show any steroid damaged faces recovery permanent results not show. Oh, that is for steroids. So, steroid-induced facial dermatosis. Okay,
Hmm.
so we show cases also in the videos. Also, we show cases, Priya, where we recover these patients who have uh, done who have used Betnovate or other steroids like this.
Hmm.
So it is a long journey, and it needs a lot of patience on the part of patient as well as part of doctor. And you can say these steroids are finasteride of skin. So as
Yes,
finasteride is given to cover up everything in hair, steroids are given to cover up everything in skin.
yes,
So
sir.
अगेन उतना ही बड़ा डॉक्टर जितना बड़ा वो स्टेरॉइड्स यूज कर लेता है आराम से फेस के ऊपर,
So
और उतनी
somebody,
बड़ी लाइनें लग जाती हैं.
yes, sir. Sir, somebody is asking 0.5 milligram finasteride without medical supervision हम ले सकते हैं क्या?
I won't advise this because it can be a problem. See, the purpose of making these videos is not to giving you straight medical advice here. It is just to make you, understand the concept so that you can, when you go to your respective doctor, you are knowledgeable and you won't fall prey to those tactics which can really be harmful. So
Yes.
don't take it under without medical advice, please.
Next question, please.
मेज इज 32, लेकिन सर मेरे आगे से साइड और अब बीच के बाल हल्के होकर उड़ गए हैं. हेयर ट्रांसप्लांट के चार्ज और कॉम्प्लिकेशंस बताएं प्लीज. Okay, so you can connect the team. There are so many videos which we have already made on this topic. So Ravi, hair transplant के कॉस्टिंग के लिए आप टीम को कनेक्ट कर सकते हो. कॉम्प्लिकेशंस काफी हो सकते हैं. अभी हम रिपेयर में वही सब डिस्कस कर रहे थे. बैड हेयर ट्रांसप्लांट तो अपने आप में एक बड़ा कॉम्प्लिकेशन है. And not all transplant surgeries are successful. Even
Yes.
after 20 years of experience and that much of work and difficult work under my belt, मैं फिर भी बोलूंगा कि मेरे भी कुछ रिजल्ट्स कभी कभी मेरे एक्सपेक्टेशंस के नीचे आते हैं. सो
Hmm. Hmm.
इट्स बेटर टू चूज अ सर्जन जो अच्छे से ये सब चीजों को समझ सकते हो, कर सकते हो. बस. नेक्स्ट क्वेश्चन प्लीज. आईब्रो का इम्प्लांटेड हेयर नॉर्मल हेयर जैसे ग्रो क्यों नहीं करते, क्योंकि वो भी तो नॉर्मल है. आईब्रो हेयर ऑब्वियसली आर टेकन आउट फ्रॉम स्कैल्प विच कैन ग्रो इन लेंथ मोर. सो आपको इसको कट करना पड़ेगा अर्लियर. सेकेंडली, the angles are I mean changing every point,
Key
and
point.
these are very soft thin hair, so we don't have that exactly same hair as donor available. In fact, today we are doing an eyebrow transplant
Yes, yes.
also, so
And also, sir,
it's
again,
tricky.
eyebrow transplant is not something that people show in their marketing pictures. As again,
आएगा
it
नहीं.
is purely
Yes,
surgical skill.
very, because finasteride is again not going to cover up this. So people who are showing you results of actors, cricketers, grade 6, grade 7, like God, they won't show this much. Next question, please. You have discussed the consequences of hair transplants in previous video and mentioned the case of Pakistani actor. Is it made the mistake by surgeon? Oh, which Pakistani actor?
So I
I
also
think
think,
maybe
but
he might be talking about ischemic necrosis. There was
yes,
one case.
yes, yes,
So see, okay. In fact, we also in my practice, I have seen 7, 8 cases of ischemic
yes,
necrosis in
yes,
my our patients, huh?
yes, sir.
And uh, we repaired all of them,
Hmm. Yes,
and
sir.
fortunately, they are doing well. So this is because of lack of blood supply in particular areas. So there are some watershed zones. There are multiple arteries supplying a particular portion. But if there is only one end artery supplying a particular portion, then damaging that artery. Since transplantation is a blind procedure, we don't see the vessels underneath the skin. So in that situation, the area can have ischemic necrosis and scarring. So it is not a mistake by surgeon.
Yes, sir. Any more questions? I think we have, sir, pretty much covered everything in our talk.
Really appreciate your consultation, which shows great care for all. Thank you for taking your time and giving a great explanation pre and post. Thank you so much, Mr. Khan. Yeah, we actually emphasize a lot on knowledge and information, which is so important. And there, because there is a huge gap between expectations and reality, and in case people because there is lots of information available on internet which just pushes you
Yes,
to go through something which you may or may not need, which may or may not fulfill your expectation, but in a rush of blood you just go because there is a huge temptation. So my advice to you guys would be, any information which makes you think is the right information for you, and I think you should pay more attention to that information. Any information which just lures you into something is not the right information.
mention. Yes, sir. So, sir, let's bring the takeaway messages of today's chat.
Yeah, so it is important to bridge the gap between expectations and reality. Too low hairline might be unrealistic and unsustainable in long run. And you can take example of Elon Musk in this. He got a transplant in 2002, kept a high hairline, then brought it down. Always choose a clinic well versed in, yes, always choose a surgeon who keeps your long-term interests over short-term glory. Yes, it is, you are not a one-time glory for us. Baldness can be progressive, so you might require planned successive hair transplants, and the resources should be used judiciously. Right time, right dose, right intent. So these are the important takeaways from this. And if you have questions now, yeah,
So I think questions we have pretty much covered most of the questions during our initial discussion as well.
yeah.
Yes, sir.
So if
We
you
have
if
covered.
you guys want us to cover a topic like this, you can leave it in the comment section. You can ask us, call us. The numbers are given they are in description also. You can connect with us or at given numbers if you want to plan your journey. See, one thing again important, planning is a very, very important part of this journey. And even if you have foundations of geographic foundations or financial foundations or whatever kind of foundations, I would still urge you to plan your journey with someone whom you can trust. So if you don't do that, it may really, hit you hard in your heart. So, so be careful, and if you have questions, you can connect to us at the numbers which flash there. You can connect with us through the site, and very soon you will see a new website of ours. This would be satyahairsolutions.com, and there it would be a complete Bible of our work which we have done. You will see there, and I don't think you will need anything else to understand any concept in hair restoration. Any concept, nothing is untouched. Everything will be covered. So stay tuned, stay connected, stay blessed, and have happy hair, joyful life.